Okay, so I'm Dr. Nathan Rose. I'm actually just finishing my second year here at Notre Dame. I received my PhD from Washington University in St. Louis in 2010 and had several stints of research fellowships, first at the Research Institute affiliated with the University of Toronto in a Jewish geriatric hospital. And then in the Department of Psychiatry, the University of Wisconsin in Madison. Go Bucky, that doesn't resonate very well here. And then actually took a trip to Australia and lived in Melbourne for a time and worked at the Australian Catholic University there in a Cognition emotion, working on a federally funded grant from the Australian Research Council. Okay, so I have a bunch of slides here, but I don't want this to be a formal lecture. I want this to be more informal discussion. So if there are questions along the way, feel free to interrupt. And the main things I want to get across, what I'll be covering, is just what memory is. Memory is not just one thing. There are many different forms of it, and there are some really important distinctions that I think everybody should know about. And so I'm going to be talking about that. And then this is important to consider the different forms of memory because there are different differential effects of aging, the normal aging process, on different types of memory. So I'll be talking about some of that, as well as some key brain structures, and talking about some advanced cognitive neuroscience methods that are being used today to sort of read minds using brain decoding methods, and be talking about some newer forms of non-invasive brain stimulation techniques, which I'm using in my laboratory that I've set up here at Notre Dame. And then try to provide some real-world tips on some advice, some things that are known to sort of benefit and support memory in the real world, and talk about some sort of caveats and some limitations about some areas that people think might help, but there's really sort of lacking scientific evidence. So. All right, let's dive right in. So memory is not just one thing. So we talk about the biggest distinctions between short-term memory and long-term memory, but this is a really important distinction and people get this sort of mixed up because it is kind of confusing. So short-term memory, I'm not talking about like what you did yesterday or where you parked your car last week or what you had for breakfast even this morning. When I say short-term memory, we're really talking about a very short-term scale. So sensory memory, so what we recently perceived just over a second, and then what information we hold in what we call working memory, the information that we use to work with representations. So when I learn somebody's name, I have that in my working memory and I'm trying to attend to the conversation, but naturally the conversation shifts to somebody else, and then I come back to this person, oops, what was this person's name again? That's the kind of short-term working memory that I'm talking about. Whereas long-term memory is really sort of more a longer lasting time scale, but a lot of long-term memory processes operate at these very short-term time scales as well. So what most people talk about when they say, I have good long-term memory, but bad short-term memory is this form, this distinction between recent versus remote long-term memory. So recent long-term memories are the stuff that just happened and you're still working to consolidate. The remote long-term memory is like, who can remember their phone number when they were 10 years old? No problem there, right? That information was encoded. You had a very healthy brain, and that's a piece of information that you used a lot of retrieval practice. So that's been really well established and represented in the brain using different systems than these more remote recent sort of volatile short-term memories, okay? And I'm kind of highlighting here, just prefacing, using color coding to indicate which areas show sort of sustained or even beneficial effects in the normal aging process in green, and those that are more sensitive, more susceptible to the pathological processes that occur as a function of age in red. Okay, so collectively, there's these two forms of long-term memory. We need to make the distinction between declarative and non-declarative, or what's called explicit and implicit. So explicit are these declarative ones, where you actually have to declare a piece of information. You're asked a question. When did you see this person? What happened at that point in time? Then you have to retrieve and produce that information. Implicit memory are the kinds of memories where our behavior is biased, but we're not really aware of it. So your prior experiences are constantly influencing your current behavior at a very implicit, non-conscious level. So these are all the things like skills and habits, priming, classical conditioning, habituation, sensitization, really different retention rates. So the adage, you never forget how to ride a bike, that sort of thing. So that's a procedural kind of skill. That's very different than the explicit, declarative kinds of memory that we talk about. And we also need to make a distinction between facts and events, or facts, which is like our semantic memory, our world knowledge, the information that we've learned, and episodic memory, so retrieving very specific details about specific episodes that happened at a previous point in time. And these different types of memories rely on different types of brain structures. So you don't need to worry about this too much, but I just want to point out that, and this is a limitation of thinking about memory in this way, because it says that only the neocortex is involved in this, and only the frontal lobe is involved in that. And that's not true. These highlight areas of the brain that are really important for different types of memories, but really the brain is this massively interconnected network of regions. So all of these kinds of processing involves a really widely distributed areas of the brain, really commonly activated areas. So this is just highlighting areas of the brain that are really important for specific kinds of memory. But I think it's really important to do a demonstration. Here's first real-world tip number one, using a Facename mnemonic. So using that example of how difficult it is to learn somebody's names, faces and names are really hard. Everybody says, oh, I'm not good at names. You know, nobody is. Faces and name associations are really hard, but there are some tricks that you can use to establish more effective memory representations that will be more accessible later on. Okay, so using this example, so you see this guy, Rodney Flannery. Okay, so oh shoot, how am I going to remember this? So if you use this Facename mnemonic, what you want to do is establish a meaningful association, something to connect the image, the person's face, with the verbal information, the name that you want to attain. And there's nothing about that guy's face that says Rodney, but if you do this little trick, this memory encoding strategy, let's imagine that he's a football player with a rod in his knee, so he's benched, and so he's wearing flannel to stay warm. Okay, so then the next time you see this guy, Rodney Flannery's face, say, why am I imagining him with a football helmet on, wearing a flannel? And that gets you to, oh yeah, he's got a Rodney, and he's sitting on the bench, he's a Flannery. This is how this kind of semantic association in critically connecting with visual images is really beneficial for learning and remembering face name associations. So why don't you introduce yourself to the person you're sitting next to and give this a go for yourselves. Try to come up with one for yourselves. So whose partner told them a really good one, a really clever one? Whose partner told them a really good, clever one? Yeah.
This gentleman's name is John Keys, and he said, just remember it's the key to the can.
John Keys, just remember key to the can. That's good. So for myself, we went through this when I was in graduate school and went around the room and got to me, and there was this loudmouth Australian guy in our class who says, let's call him Neonate because he looks like a baby. So that works pretty well. All right, so the point is that this is a really effective memory encoding technique that benefits memory later on, these long-term memories. And when you're meeting somebody and learning their name, that's a very short-term, volatile kind of memory, really susceptible to interference. So it really helps to do this elaborative processing. And ironically, the more sort of extravagant or sort of weird, bizarre, especially imagery, involving imagery, the more it engages those processes, the more beneficial it appears to be. So there's a really important distinction that needs to be made to the kinds of processes that are important for short-term memory. And so, for example, in graduate school, I did some early work looking at this distinction between immediate memory and delayed memory to really show differences between short-term memory and long-term memory, whereas processing information in terms of shallow visual or phonological features is not very good. for long-term memory, but it's totally sufficient for short-term memory performance. And so that is a piece of research that points to the similarities, or sort of the differences between short-term memory and long-term memory, but there are a lot of similarities between these two different forms of memory as well. So for example, did a study in Toronto with this rare amnesic patient, patient HC, who has a developmental form of amnesia. So she was a young woman. She never fully developed her hippocampus and the medial temporal lobes, really critical structures for long-term memory performance. So she has this profound episodic amnesia, can't remember episodes that happened previously. But we wanted to test the idea that her short-term memory would be totally intact. And I hypothesized that it should be for famous faces like Paris Hilton or Julia Roberts, if you can't tell. It's kind of a weird computerized image of her, but nonetheless, most people recognize her, and she was totally fine for famous faces, but for the non-famous faces, where you have all this novel information and this new face, you have to bind all these features together, that's what the hippocampus is really important for, and so she shows this deficit for holding on to a single face over delays as short as a single second or 8 seconds. So it's like the 2-second Tom in that 50 First Dates, somebody walks in. Yeah. So it's the distinction between short-term memory and long-term memory is really quite complex. This caught some traction in the news. I like this part here. A study showed that an amnesic remembers a celebrity the rest of us forgot about. Like that. So another important part of memory that I think everybody should know is people think about memory as just one thing, but it's really important to think about the different stages of the memory process. So these are the different stages that we think about when memories are encoded. You initially learn a piece of information. Then that information needs to be stored and consolidated in the central nervous system in some way. And then there's a retrieval process to recover and regain access and bring information that was previously experienced back into conscious awareness so that you can think about and work with that information. So it's really important to think about these different stages. And so when somebody forgets something, why? Was it a failure of memory, encoding, storage, or retrieval? So forgetting can really be due to a problem with the availability. You just didn't really encode it very well, or something happened during the storage consolidation phase, so that information never really laid down a good trace. Or it could be due to the problem with accessibility. You just have trouble retrieving the information, the desired information, at the point in time. So the tip of the tongue state is a good example of that, where you know the information, but you just can't access it, you can't get it. So problem with availability, for example, you never really lay down a good encoding of information or consolidation, so maybe this is like remembering the events that happened after a long day of tailgating, for example. But there is an interesting phenomenon here, associated with this storage consolidation phase, which is really susceptible to interference. So students love learning about this. There is a phenomenon called alcohol-induced retroactive facilitation. So the idea here is that a lot of students will cram and study really hard for a test, and then once the test is done, then they go out and have a big party and get really drunk. And the ironic thing is that when the students are really impaired and not encoding information very well when they're partying and drunk, that's presenting less interference to the information that was previously studied. So they actually remember the stuff that was previously studied slightly better. And then I say, it's actually a pretty small effect, and it's complicated, and so don't actually go out and try that. But they love learning about that nonetheless. Okay, so let's think about aging and what aspects of these different forms of memory are really sensitive to aging. So this is what the typical pattern of age-related differences looks like. Yeah, pretty bad, right? But the story is not all grim. Look at verbal knowledge. Verbal knowledge actually goes up so things like vocabulary, crossword puzzles, reading ability stays really well preserved in later life. But there are these differences between different types of memory. So the short-term memory is slightly better preserved. So learning a phone number and repeating that out loud versus this more working memory, sort of dealing with distraction interference, a bit more sensitive to aging. So this picture is a very common one when talking about age-related differences or changes in memory, but it's not actually, it sort of leads people to the wrong interpretation. So I have kind of an aside here that I can talk about if anybody wants to. So this is cross-sectional data, and it is kind of important. You see this pattern with very specific kind of methodological and statistical sort of issues. Would anybody like to know more about this? Yeah. Okay, so why this is kind of the wrong way of thinking about age-related differences in memory. So this is z-score, so the standardized unit, so one standard deviation is 1, and so this is relative to people in their 50s, so the average sample as 0. And so you might think that, whoa, look at this, between 50s and 70s, you're going to drop about a full standard deviation. You're going to go for, okay, I'm normal, all the way down to, what do they call it, dull normal? and sort of analogous to the intelligence quotient, so the intelligence bell curve. But it's important to acknowledge that this is cross-sectional data. So this is what this pattern looks like for episodic versus semantic memory as a function of age relative to the healthy younger adults, this sort of decline. And it's sort of not so linear, but slightly worse fall off for the episodic memory tasks in later adulthood. But it's important to adjust for education. There are all sorts of confounding factors that contribute to this. So all sorts of other things that you need to control for. So if you control for education, which really has a really strong effect on semantic memory, so your world knowledge, things like vocabulary, that's the kind of age pattern that looks like for the different types of memory between episodic and semantic. But there's another thing that the cross-sectional data is taking group averages at one sort of age range, bin, and comparing them relative to other group averages in different age bins. And so it's really important to consider one's own performance across time, right? So longitudinal data has a very different picture. So this is what the difference looks like for longitudinal data, comparing oneself to previous and subsequent assessment occasions. So there, it's a very, very different picture. So relative to when they're first tested, looks like people are improving in episodic memory. Is that what? Well, no, what happens when you're repeatedly tested on the same kinds of tests? You tend to get better. So then it's important to correct. So it's really important to consider longitudinal data, so within person variability over time, but it's also important to correct for the practice effects that occur with multiple test occasions. There's another reason why looking at data even like this is kind of flawed. This is one data point, the average for a group, when in fact there is tons of variability. So if you look at each individual as a dot and the lines connecting the dots, that's the same individual on different testing occasions. There's a lot of variability. Some people are going up, some people are going down, some people look like they're okay, and then they go way down. Okay, so it's important to understand the dramatic range, yeah. Okay, so there's two things to note here with these kinds of patterns. The very large intra-individual variability, so variability between individuals. So people are very different, and some people look like they're doing really well, better at the age of 90 than some at the age of 60. But then there's also a lot of intra-individual variability, so change within an individual over time, over assessment occasions. And this change is what we're really, really concerned with. If somebody looks like they're doing okay, and then all of a sudden, wow, grandma, mom, dad just really looks different relative to last year. That's what we're looking for. So why? Why are some forms of memory more sensitive than others? Well, the normal aging process is associated with some changes to brain structure and function. A lot of the changes, the most severe, that big change in cognitive performance and memory performance is likely due to a lot of neuropathological processes that are going on. So this is the brain for someone in the advanced stages of Alzheimer's disease versus a healthy brain. And so it's important to acknowledge that, whereas we used to talk about senility as just the aging process, and the term senile dementia, that this is what everybody experiences, we don't use that term anymore. One, because it's sort of derogatory connotation, but also it sort of assumes that everybody will eventually progress and form this senile dementia. That's not the case. Dementia is the consequence. It's the result of really slowly evolving neuropathological disease processes that are really likely beginning much earlier in life, probably just undetectable. So it's important to make that distinction between sort of disease process versus normal aging function. So there are some normal, natural changes in brain structure and function that occur as a function of age, and in particular, the prefrontal cortex in the front part of the brain are particularly susceptible. And whereas in Alzheimer's disease, it's the sort of more diffuse network connecting the prefrontal cortex and posterior regions in the parietal cortex and temporal cortices, particularly in the medial temporal lobes, that are particularly sensitive to the disease processes. But here too, there's a lot of variability between individuals and over time. So this is the volume of the lateral prefrontal cortex as a function of age from young adulthood into older adulthood, and the hippocampus. And so you see this sort of linear decline for the lateral prefrontal cortex and this hippocampus decline in volume with a more sharp drop-off towards the end. And these are the individuals with that sharp drop-off that are more likely to be experiencing the effects of dementia. So what is dementia? The accumulation of these amyloid plaques and neurofibrillary tangles, which result in cell death. So this is a picture of what, if you take the actual slices within different brain regions, look at the stains, the accumulation of the amyloid plaques and these neurofibrillary tangles, which sort of muck up the neurons in the network and eventually result in cell death, as compared to healthy brain tissue. There are also some other sort of large-scale structural changes that occur associated with cortical shrinkage, so smaller brain volume in general, enlarged ventricles, so more cerebrospinal fluid, and particularly hippocampal shrinkage in the medial temporal lobes. So what is dementia? This is another important thing that I think most people should know about. That dementia is really an umbrella term. It's not one thing. Parkinson's disease is a form of dementia, for example. Alzheimer's disease is the most common form. Vascular dementias is the second most common form. There are all these other kinds of dementias, dementia of the Lewy bodies, frontotemporal dementias, and there are other mixed dementias that are associated with other comorbidities in particular, so Korsakoff syndrome, for example. So you can see here the sort of pie chart, the distribution, the frequency of the different types of dementia. So I think it's important to acknowledge that there are these different forms, and so and then some statistics about how big of a problem this is. We all know a recent term I heard about this, just sort of advancing aging population in really all parts of the industrialized world. It's the silver tsunami. There's a silver tsunami coming. So it's sixth leading cause of death currently. Costs of our healthcare system, $259 billion last year. By 2015, that'll more than double to a trillion. So just some statistics here about the frequency and how big of a problem this really is. I'm happy to provide these slides so people don't have to take notes. Yeah, question?
The every 66 seconds one versus the one in the United States develops disease, is that actually developing it or being diagnosed?
Yeah, so that's a complicated issue. So I just said that the development of the disease process is likely to occur much earlier on in even middle adulthood. A lot of research is looking even earlier, trying to find the biomarkers that signal that there is impending neuropathology. Now, it's not that there's one sort of 100% sensitive and specific biomarker. It's a constellation of factors. And so one of the main take-home points I want to describe towards the end of my talk is how the aging process is really has a lot of plasticity associated with it. So there are some moderating factors, some lifestyle factors that do seem to impact the probability, the rate of decline, or the probability of developing dementia to a really significant degree. And so what this means is that there is a lot of factors. It's modifiable. It's plastic. So there are things that can be done over the course of one's life to sort of defray the onset of cognitive decline, or even minimize the risk of developing dementia. Yeah.
Could you comment on the role of inflammation, systemic health, and how that may associate with Alzheimer's disease?
Yeah, so particularly the vascular dementia, so the cardiovascular system, and there are all sorts of comorbidities associated with the development and onset of dementia. So the gentleman asked a question about the role of inflammation. And so the two hallmarker biomarkers of dementia so far are the amyloid plaques and the neurofibrillary tangles. The amyloid plaques, the sort of a amyloid beta protein sort of develops in excess in certain parts of the brain. You can see that here in the prefrontal cortex, this area that's really sensitive to dementia. And the presence of amyloid is an important inflammatory response to some kind of neuropathological process. Now, it's a complicated story because healthy people have a lot of amyloid. Some healthy people have a lot of amyloid. Some people with really severe dementia don't seem like they have a lot of elevated levels of amyloid. And so, I mean, this sort of gets us down in a rabbit hole, so I'll try and describe it briefly, but then come back from it. So when neuroimagers first started looking at the areas of the brain and these different processes that are predominant in Alzheimer's disease, naturally focused on these elevated levels of amyloid. And so the hypothesis was that this was what was causing, and this buildup of this gooey amyloid protein was resulting in these neurofibrillary tangles that then sort of muck up the neural signaling across distributed networks and eventually lead to cell death. And so naturally the focus on pharmaceutical development was on clearing the amyloid. So you can clear amyloid, and that's what all the drugs have been focused on. Problem is, in a lot of situations, it leaves these gaping holes in healthy neural tissue. You can clear the amyloid, and it doesn't seem to have any effect on cognitive function. And so really, it's kind of a big problem is the whole amyloid hypothesis as being the precursor or the sort of driving force for Alzheimer's disease is now considered to be basically wrong. And billions of dollars have been invested, for the past, 10s, 20s years into addressing this amyloid hypothesis. And now there's a big shift in thinking about, there's something else going on before that. So the amyloid response is likely to be in response to some other pathological process that's going on before, likely much earlier in life. So now the big focus is on finding individuals who are healthy much earlier in life that have these sort of signaling biomarkers, this constellation of biomarkers that indicate a higher probability of risk for impending decline, and figuring out how to intervene at those stages. Yeah.
Have they done any studies on homeless medicine with respect to chemical reaction in the body which affects the immune system naturally, to the point that you're just making?
Yeah, so can you repeat the question so I can repeat it? I mean,
in Europe, they don't use medication for cure. They use holistic. In other words, make the body
homeless. Oh, holistic. Yeah.
Senior moment. But anyway, is there any studies been made with respect to basically make the immune system of the body chemically through infusion of things that basically make the body cure rather than having some drug cure?
Right.
Studies been made on that?
Yeah, so this brings up a good point about sort of holistic alternatives to pharmaceutical treatments, and there has been a lot of research that's looked at mostly sort of demographic studies, of, epidemiological studies of populations. And so what sort of factors, lifestyle factors, seem to be associated with reduced risk of development of dementia and Alzheimer's. And so I'll talk about that towards the end, which really points to some modifiable lifestyle factors that can be incorporated throughout the course of one's lifetime that may have some protective effect in developing dementia or Alzheimer's. Now, sort of the immune system response. So, I mean, the brain is a part of the body, right? So it's impossible to consider the body absent from the brain and vice versa. So a big focus is on sort of using these factors that we know are beneficial to sort of brain and body health. So things like diet, exercise, stress, sleep. So yes, these are all important aspects. Now, any sort of nutraceuticals or sort of supplements, there's really mixed, limited scientific evidence pointing to any one particular type of sort of a vitamin supplement, for example, that has a really strong effect on protecting against dementia. So unfortunately, because we are still without a cure and a sort of really robust form of treatment, we are focusing, myself and my students in my lab, we're focusing on alternative methods. So I want to get into a couple points about, I did have, this is an aside about mild cognitive impairment, which I'm going to skip unless anybody really wants me to get into this, about the distinction between MCI and dementia. And again, I'm happy to provide these slides and how to distinguish between MCI and different forms of MCI and the different diagnosis categories. But I would really like to briefly describe some of the work that we're doing to sort of how, what is modern cognitive neuroscience doing to address this problem? This is a really big problem, this silver tsunami I was describing. So I'll briefly describe some of the work that my lab and I are doing using a variety of advanced technologies, approaching it from both a basic science perspective as well as an applied science perspective. So in terms of a basic science, what we're trying to do is figure out a really good mechanistic understanding of the basic neurocognitive processes that support this ability to encode and form memories and maintain them over brief periods of time. I mean, it's such a complicated process that we don't really have a really comprehensive model or theory to explain all of the different mechanisms that go into supporting the initial forming and consolidation of a memory over brief periods of time. So that example of learning somebody's name, attention shifts, and how do you get that back? So we're starting with the very basic roots of when you first get a memory. And so what we do is we have people perform a task where we give them information to remember, like a face and a word, and then they have to remember this information. We tell them which one to focus on at a particular point in time, so these cues, and then we test them, and then we switch and tell them to focus on the other item that was presented. And what we can do is while people are in an fMRI scanner and we're recording the brain activity, we can take that brain activity and train what's called a machine learning algorithm, a pattern classifier, a multivariate pattern classifier, to decode the categories of representations that people are thinking about. And so we can track that neural evidence in the active representation of a particular piece of information over time. So, for example, we can see evidence for both a face and a word, elevated initially, and then when we cue the red item, say the face, we see sustained activation for the face, whereas the other item drops as if it's been forgotten. But then when we cue the subject to switch to thinking about the other item, we see the corresponding crossover in the pattern of brain activity. And now what we can do, knowing that we have this pattern of we're tracking what is in mind, we're decoding the contents of the mind, we are trying to understand how people retain information when they're not actively attending to it and how they recover it. And so we are using a form of non-invasive brain stimulation called transcranial magnetic stimulation, so TMS. Basically the way it works is you have this wand and we can hold it over very specific parts of the brain. I can find your motor strip, and for your left thumb I can make your thumb twitch. I'll show you an example of it in a second. And importantly, this is a painless, non-invasive form of brain stimulation that's really specific where we're stimulating and the time at which we're stimulating. So we're applying this form of brain stimulation to areas of the brain that we know are really important for representing different types of information with this wand, and showing that with this brain stimulation we can actually causally reactivate a memory. So there's a reactivation of this latent memory that looked like it had been forgotten. So we're using these combination of tools to sort of probe the basic neural substrates for holding on to information and recovering information. And the goal is that if we can understand this, we can start to see what specific processes are impaired in older adulthood, and then what can be done about it. So I'll show a brief video of how this actually works. So we have this navigation system so that we know that we're targeting a very specific part of the participant's brain while they're performing a task. We're presenting stimuli and the participant is responding, and we're recording their brain activity with this EEG cap. And we can apply these data analytic techniques to decode, sort of read their mind and track what information they're attending to over time. Okay, so with this research, basically for the past 2 years since I've been here, I've been applying for I think like 5 grants now to basically replicate this in older adults to see if there's a deficiency in a specific type of process that we can sort of target. And then if we know that there's a specific deficiency, we're trying to develop mechanisms to use this form of brain stimulation to actually enhance memory functioning. Unsuccessful so far, but that's the way our federal funding sort of works, and it's like 3 years of back and forth for a 50 percentile funding rate. You know, it's like 3 years of work for a coin toss. Okay, so that's sort of the basic science we're doing, sort of just trying to understand how memory actually works at that really sort of microscopic level. Now, we'll also do, I'm kind of take the approach that a lot of people will stay focused on one research area, but I like to have both basic science and applied science. So we're also trying to establish ecological assessments of memory and apply cognitive training and memory strategies to try to see if we can improve older adults' memories. So have you ever forgotten something at the store, or taken a medication, or forgotten to turn the iron off? You're driving down the road, oh shoot, I better go back and check, yeah? Or even why you got up and walked into the other room, and then you have to go back. It's like, oh yeah, now I remember. Yeah, that's encoding specificity, actually. So the match between encoding and retrieval, that's an important principle of memory. That's a normal thing. That's a normal thing. And everybody does that, but people interpret it in different ways. So if a younger adult does that, they say, oh, I just wasn't paying attention or had something else on my mind. Older adult does it, say, oh no, I've got dementia. So they, no. What did one of my participants tell me one time? Says, well, it's not if you can't remember where the keys are, it's if you can't remember what the keys are for. Okay, so this prospective memory is a different form of memory. This is a really important one for our everyday life. This is remembering to remember, to do the things we have to do at the appropriate moment in the future. So we've been developing these sort of game-like sort of tasks to measure this prospective memory ability. So it's have people play this Monopoly-style game. We prepared a computerized version of it. You have to take your medication at the breakfast and dinner events. And so these E-squares, you have to pick up an event card, and we don't remind them. You have to remember on your own to take your medication by clicking on a button there, or taking some other medication sort of on a regular schedule, and then running errands and doing tasks like remembering to drop off the dry cleaning, or schedule an appointment, and so we measure prospective memory performance in this way, and this is really sensitive to the normal changes as a function of age, and it's particularly sensitive to these more pathological changes in the different patient populations that we've looked at in this. So individuals with very early stages of Parkinson's disease or Alzheimer's disease, for example. And so what we've, and again, it's important to think of this prospective memory form of memory as multi-phase process as well. So from the encoding, intention formation, retention, and then the intention initiation and intention execution phase. And so if you forget to do something that you meant to do, it could be due to a failure with any one of these different processes along the process. And they involve different stages of cognitive processes, and then there are different cognitive substrates or neural substrates that support these different aspects. So it's important to think about these different aspects. And so what we're trying to do is develop naturalistic assessments. So how are we measuring? How are people doing in the real world? Maybe this is a good proxy. And then if we can measure it really well, we've done this in a variety of ways. So we also did this breakfast task. It's sort of a kind of game-like task where you have to cook a big meal you're basically hosting a big event, and you have to time the cooking of all these different foods that they all finish at the same time together, and you have to set the table. It's a really challenging multitasking sort of scenario, and again, seems to be really sensitive to normal changes of age. And so we're trying to establish these naturalistic assessments, and then we've identified that there are large age-related declines for many of these tasks, and that it is really predictive and associated with activities of daily living, sort of functional independence. And so now we're trying to see how can we improve this ability, and will it transfer to memory benefits in the real world? And there are different approaches to sort of cognitive training. Some take the more like brain game approach, so like the brain is a muscle, so let's really work it out, this process-based or restorative form of training. Other approaches take the more strategy training approach, where here is an effective memory encoding strategy. And so this is what I'm going to tell you about, this implementation intentions, this see it, say it encoding strategy. It's really, really effective. I'll describe it when I get to the study that I'm going to briefly talk about. And then we're also looking at these different forms of non-invasive brain stimulation. So transcranial direct current stimulation is another form of stimulation. You may have seen this. It's basically like a 9-volt battery, and you hook 2 electrodes to your head and apply a very low level current, so it doesn't hurt. It's not comfortable. It kind of itches and tingles, but it's not like burning you or shocking you. It's just applying a low level electrical current, and the idea is that some of the current actually crosses the scalp, skull, dura mater, and gets into the brain to modulate cortical excitability under the electrodes. It's not as potent of a form of brain stimulation as the TMS that I was describing, where I can specifically find a particular area and make those neurons fire. This form of brain stimulation doesn't cause neuronal firing directly. Okay, so what can we do about this? So we developed a training version of that virtual week game and had people play up to 24 levels, and we got people up to, these are healthy older adults between the ages of 60 and 80, and we got people up to remembering to perform over 10 tasks correctly over the course of one circuit of the board. It's really quite phenomenal when they start out at a very low level. And one thing we were hoping that this form of sort of brain training, this process-based training would do is it would actually teach people to learn how to develop more effective strategies. So we looked at the strategies that they reported over the course of the 4 weeks of training. But most of the people by the end of, after playing this game for a month, were still using what we call relatively poor strategies, no strategy or poor strategies. So things like concentrate, memorize, as compared to this one that I'll tell you about, this implementation intentions, which incorporates good encoding techniques like visualization. But nonetheless, we actually did see some encouraging results. We found some really strong near transfers, so people get better on the task. So, things like lumosity, you will see yourself get better on the task that you're doing. But the question is, will there be far transfer? Will it transfer to other cognitive abilities like the things going on in your daily life? That's what's really hard to obtain. And we also found some evidence for a modulation of the neural processing of a prospective memory task while we were recording this EEG. Won't go into the details there, but no real transfer to this sort of computerized lab-based measure of prospective memory. But we did see some encouraging results of transfer to real-world types of activities, like this callback tasks that people had to do in the real world relative to a control condition, and instrumental activities of daily living. So it seems like playing this game may have actually produced this far transfer effect that we were really hoping for. Now, we also know that this implementation intentions in coding strategy is really effective. So we also looked at whether we could even benefit performance in individuals in the very early stages of Alzheimer's disease. So the CDR.5 category. And so this implementation intentions is basically like the see it, say it. So if you say, when I see David, I will remember to ask him a question. And so when you have something you need to do, if you go through this process of when I see, when I'm driving past Martin's, I will pull off and get some milk for tomorrow. And if you do that, at the beginning of the day, and you go through this process of making that statement and visualize it, thinking of yourself going through, and later on in the day, when you're driving past Martin's, you're much more likely to spontaneously remember. So, oh yeah, I have to stop and get some milk at the time. So this is a really effective encoding strategy. So this is a good everyday memory tip. And we did see that individuals, even in the early stages of Alzheimer's disease, show this improved benefit in the or a reduction in the number of prospective memory tasks that they missed to perform on this task. So we're not going to stop there, though. These are still sort of these cheesy little computer games. And sorry, question?
With the see it, say it, does it actually increase your memory retention if you actually verbalize it as well, instead of just internally seeing it, say it in the brain?
Yes. So actually, that's a good point. The question was, does it help if you actually verbally state it aloud? And that is the case. Yeah, this is something called the production effect. So if you say something aloud, your memory is better for that information than if you were to just say it to yourself internally. Yeah. So talk to yourself, exactly. But not too much, or people will think you have schizophrenia. Okay, so really excited about this work we're doing in my lab here now. We're not stopping here with this computerized game. We're taking it a step further, 2.0. We have these virtual reality headsets, because in this computer game, you're not actually performing the task. And we think that when you're actually doing it, that's going to be the best way to measure it. So we're having younger and older adults put these headsets on and play a game. And in this game, they have to be a short order cook. And they have to be a convenience store manager. And they have all these tasks they have to do. And they're walking around in my lab and doing it. And people think it's so real. I had my dad do it, and he was done. He went to put the controllers on a virtual table, and he dropped them, and they just dropped to the floor. But this virtual reality technique is really powerful. It's very immersive, really powerful illusion, and we think that having these embodied actions is going to help us better measure this real-world perspective memory. And if we can measure the real-world performance better, then we can apply our training techniques to try to improve older adults' perspective memory. And the whole goal here is, until the pharmaceutical industry catches up and gets their stuff together and provides a cure for all these people, we're going to have so many people that need to stay at home living independently. And we have to keep people sort of functioning at an independent, functional level. And this is one way that we're hoping to accomplish that goal. We also have this treadmill, so you can sort of walk around and in this virtual world. It's pretty crazy. Okay, so just to sum up, some tips for supporting memory. We talked about that elaborative encoding technique, so like the Facename mnemonic. So establishing a really meaningful association, visualization. This see it, say it, the implementation intentions. When I am eating my breakfast, I will take that new medication that I just have. If you do that and think about it and visualize yourself doing it and you say it out loud, you're going to be much more likely to do it. This do it or lose it, this is a no-brainer, right? pun intended. So memory is really, really sensitive to interference, especially for these things that you just recently learned. If your attention gets drawn away, if you come back to it, it might not be there, so better to just do it before you lose it. This spaced retrieval practice is another effective way of enhancing memory. So this testing yourself repeatedly. This is something I teach on the first day of my class. And I cannot believe that these really bright Notre Dame, really, these are like some of the best students ever. They've gone through all their high school and gotten to my class, some people their junior year, and I'm teaching these learning strategies, this testing, repeated testing effect. And so many of them is like, oh, I finally learned how to study properly. I actually remember this stuff, as opposed to just cramming for tests and things like that. So this is another one, prosthetics. So we are in the day and age where we have all of these technological aids to support our memory, encoding, storage, and retrieval needs. So a lot of people sort of have this negative approach to using these technological devices, but they're really sort of beneficial for helping us to deal with the increased cognitive demands, and especially in the face of sort of negative changes in memory processing. So just some descriptions of some apps that are used, that a lot of people use to support everyday memory. And I'd be very interested to hear of the ones that you might be using in your life, the ones that you found to be effective or not. Just some notable omissions about the things that seem to benefit memory. So this Lumosity, this brain game approach, as I said, playing Sudoku makes you good at Sudoku. It doesn't really transfer to anything else that you actually care about. So, and this is a sort of a consensus statement. There's been a lot of research done on this form of brain training, and it doesn't really seem to benefit. Kind of similarly with this direct electrical stimulation. So this is the 9-volt battery connected to the electrodes, and it just doesn't really penetrate the skull sufficiently to modulate cortical excitability as much as you would think it would. So the jury's still out here. There's a lot of convincing evidence for sort of training programs with this form of brain stimulation, but is the cost worth the benefit? We don't know yet. But what we do know is sort of the no-brainer again. Diet, exercise are the things you can do over the course of your lifespan to really protect against cognitive decline and delay the onset of dementia. So exercise in particular, and we're not talking about really rigorous exercise. We're talking about like at least 3 times a week walking for 30 to 40 minutes. There's a lot of proven scientific evidence for the benefits of exercise for cardiovascular health, sort of inflammation, as well as your brain. Yeah.
Just a quick question. I noticed as your study sort of evolved, you started involving more of the senses, so like body movement. Is it as you add in more of the senses, you're better able to remember things or strategize in a better way?
Yeah, so the question was, does adding in more sensory modalities facilitate memory? And that is definitely the case. So you can think about it as multiple routes to retrieval. So if you encode something in an auditory format and a visual format and a haptic, sort of action, production, all of these different sort of, but it really sort of encompasses this general principle of elaborative encoding. That sort of covers everything. So the more elaboratively you encode something, the more likely you are to remember it, especially if you do this retrieval practice. So you learn somebody's name. If you use their name every time you see them, you're more likely to remember that name for longer periods of time.
Yeah, that's the way Homer did it, right? And Plato did it.
Yeah, exactly.
They didn't have handy paper
Before you
around,
had this
so they went
fancy
to-
new technology, paper.
So they made all this fancy
Exactly,
story.
yeah. Yeah, so the method of loci you may have heard about. So a lot of orators and playwrights would use this process to remember these really complex.
Go through a tunnel.
Yeah, you go through. So if you visualize your house, for example, and you place things that you're trying to remember in different rooms in your house, as you mentally walk through your house, then you can remember where you put those things And that's sort of a, yeah.
In your chart of it here has all the green vegetables and such, but for many of us, one of the ingredients to that brain has to be blood thinners, statins, cholesterol drugs, keep going. But what do you have any research on the impact of all the cardiovascular medications and brain health?
I don't personally have any research in that area. It is a really vibrant area of research. And in fact, the cardiovascular disease is thought to be a major confound with all of these cognitive aging studies. In fact, those individuals that are showing the most significant declines are really driving the negative effects. And so, for certain studies, we'll often sort of screen for certain medications just to rule that out and look at, make sure that's not a confounding factor for the results. But that's absolutely the case. I actually saw at the Cognitive Aging Conference, there was a really interesting poster on ED, that form of ED, as an actual important predictor of subsequent cognitive decline because it's related to this, the integrity of the microvasculature system, which of course the largest proportion of these tiny little blood vessels that we have are in our brain and elsewhere. So.
You mentioned like the applied science part, and as we've been talking, one of the things you haven't talked about is like how like the memory care industry and like assisted living facilities are kind of embracing some of the science. So are you seeing the opportunities to partner with like assisted living facilities, or if we were looking at assisted living facility and trying to evaluate how they're going to support memory care, what guidance would you give us to look at those and evaluate how they do that?
Yeah, that's a great question. So how are assisted living facilities incorporating the science, and how can you evaluate whether one of these facilities is a good one or not? It's probably pretty easy to tell based on the price. So unfortunately, people who are in lower socioeconomic classes are the most susceptible to the deleterious effects of cognitive declines because they're not. They don't have the resources to support their functioning in the sort of optimal care settings. I think it is interesting that certain assisted living facilities are incorporating some aspects. So, the Memory Music Project is a good example where, a lot of my students will go to assisted living facilities and put these earbuds on and play a little playlist, and people love it, and can actually help recover autobiographical memories from that sort of period of life. It's a really interesting phenomenon. Yeah, I'm not sure. I think yeah.
30 or 40 years ago, I remember reading about fruit fly eating bats in an area, and then the local populace had Alzheimer's up at the zoo. And maybe they were eating the bats, but they were getting it. And I was wondering if anything came out of that where you could take the word fruit fly bats out of it and find out what it was that was doing this to the people. Yeah,
I'm not sure about the fruit fly bats with the increase in the rate of Alzheimer's and I'm just not familiar with the study, but it does remind me of one hot area of research is this familial form of Alzheimer's disease. So one thing I didn't talk about is the genetic variant. So everybody thinks that genes play a role. Genes do play a role. I think most people tend to overestimate the amount of contribution that genes play with this. So ApoE4, if you have 2 copies of this allele, it's going to increase the risk of Alzheimer's disease than if you have 1 or 0 copies of this allele. But the proportion of variance that explains is about 15%. So there are all sorts of other factors that go into it. But there is one form of Alzheimer's disease that is highly heritable, and it's this early onset familial form of Alzheimer's disease. And there is this family in Colombia, in this early onset familial form, People think like, oh, 60, 65? No, no, no. It's like 40, like 35 even. It's really horrible. And this is the most highly heritable form. And there's this family which it's about 50% if you have one parent. And so there's a lot of research being done to look at this family to try and understand what are the predictors, who's gonna convert, who's not, because it's literally 50% of them. Yeah. So yeah, I mean, very interesting sort of ethical issues here with DNA testing, especially as it's being, more people are doing it, there's a proliferation of this, the cost is coming way down. What do you do with that information? What do health insurance companies do with that information? Yeah. I'm not sure how much time we have here. Does it? We're done at time. I think the next one starts at 10:30. Okay. Well, if anybody has to leave, walk to your next talk, feel free to leave. If anybody else wants to continue to talk, I'd be happy to answer questions.
Have you ever heard of the NILD, the National Institute of Learning Disabilities?